Hello and welcome to KQED Newsroom. I'm Thuy Vu. Coming up on our program, a look at how the Republican proposal to repeal and replace the Affordable Care Act impacts California. And Wikileaks says it will work with Silicon Valley companies to fix the vulnerabilities the CIA allegedly uses to hack into devices. Plus, the founder of Craigslist on why he's giving millions to uphold and expand trustworthy journalism. But first, as part of our ongoing coverage of the first 100 days of the Trump administration, this week, 2 congressional committees approved the GOP's new health care plan. It would no longer require people to have health insurance, but a penalty would apply for a lapse in coverage. The proposal fundamentally changes what help people would receive from the federal government to pay for their insurance. It remains unclear how many of the 5 million Californians who got insurance through Obamacare will be affected, or how much the new proposal would even cost. For a California perspective, I'm joined now by California Insurance Commissioner Dave Jones, who is also running for State Attorney General. Commissioner Jones, thank you for being here.
My pleasure, Thuy.
Now, how would Californians be affected by the GOP bill?
There are a number of negative aspects to Trump Care. First, as you mentioned, we've added 5 million people to the insurance rolls in California thanks to the Affordable Care Act. All of their health insurance is at risk. The GOP bill would ultimately eliminate the Medicaid expansion cohort. That's about 4.1 million people. As for the 1.4 million people in our exchange, 90% of them rely on a premium tax credit subsidy, and the GOP proposal cuts that dramatically. So I think it's fair to say all 5 million are at risk of losing their health insurance.
The Republican proposal would offer individual tax credits to help cover the cost of health insurance, but it would prohibit that money from being spent on plans that also cover abortion. Now, you have said that that is directly at odds with California law. Can you explain that?
It is. Our Constitution in California has a right of privacy that's been interpreted by the California Supreme Court to include a right to access to abortions. California state law also mandates that individual and small group health insurance policies include abortion coverage. So the GOP proposal, which would deny Californians the access to the premium tax credit subsidy, is at direct odds with California law. That premium tax credit subsidy also is 36% less than the subsidy available currently in the Affordable Care Act. And for that reason, the 1.2 million Californians that rely on that subsidy currently are at risk of losing their health insurance because they'll get a lower subsidy and won't be able to afford health care in our exchange.
And House Majority Leader Kevin McCarthy has said that he believes that that California law you talked about just now is in conflict with federal law, and he is asking Health and Human Services Secretary Tom Price to look into it. I want to also ask you about the GOP contention that Obamacare has led to skyrocketing premiums for many people. Does the evidence in California support that assertion?
No, not at all. We've had a very successful exchange covered California. Rates have been increasing, but at a much lower rate than prior to the Affordable Care Act. And importantly, 90% of the people that buy health insurance through our health exchange get a premium tax credit subsidy that dramatically reduces the cost of their care. That tax credit subsidy gets cut dramatically under the GOP proposal and will put health insurance out of reach for those people.
You have said that also under this plan, with the differences, that California stands to lose about $20 billion that it was receiving to help primarily with the Medicaid expansion, or in this case, Medi-Cal. Now, if we lose that money, would you support a new revenue source, say like a tax, to help backfill that?
I think it's far too early to talk about whether the state's going to be forced to backfill that money. Right now, we're focusing our efforts on educating Californians and all Americans to the fact that Trump Care will reduce the number of people who are insured, increase costs, and lower coverage. The simple truth, though, is that the state of California and every state have limited resources to backfill the kind of federal cuts that exist in Trump Care. It'd be a very difficult thing.
Is there anything at all in the House GOP plan that you like and think could work?
They have kept the parts that are most attractive, the requirements on health insurers to write health insurance even if you have a pre-existing condition, the ability to stay on your parents' health insurance till age 26. But the parts that are necessary for the system to work, they've cut out, whether it's the individual mandate, the premium tax credit subsidy, the Medicaid expansion. All of these are important components of the provision of health care, and by eliminating them, they are dooming Trump Care to failure.
As California's insurance commissioner, is there anything at all that you could do at the state level to help preserve coverage for those who stand to lose their coverage, perhaps, under the new plan?
We're doing everything we can to educate Californians about how bad Trump care is. And it's particularly bad for those that live in the Central Valley who elect more conservative members of Congress. For example, Majority Leader McCarthy's district includes Kern County. 50% of the population of Kern County is on either Medi-Cal or buying health insurance through the exchange. These are exactly the people that will suffer as a result of Trump care. We're trying to make sure everyone understands that and contacts their congressperson to say, wait a minute, this is a bad idea. We shouldn't go in this direction.
Commissioner Jones, last month, 2 state senators from Southern California introduced a bill pretty much pushing for a single-payer plan, and it was their response to what they thought might be coming down the pipeline from the GOP on Obamacare. Essentially, what that would do is replace private medical insurance with a government-run healthcare system covering all Californians. Where do you stand on a single-payer system?
I think it's important to note that it's not necessarily a government-run healthcare system, but rather the government would be the payer. We do exactly that for the Medicare program for our seniors. It's the most efficient way of providing health care. The administrative costs and the efficiency improvements associated with Medicare far exceed what private health insurers are able to do. But you can still get health insurance on top of Medicare if you want to and can afford it. That's the idea, basically Medicare for all. I think the evidence is very strong that it would be more efficient. You get the profit taking out of the system, get the middle people out of the system, and ultimately it's the way we ought to go.
But there have been concerns, of course, about how much it would cost to put a plan like that in place in the initial stages. Commissioner Dave Jones, thank you so much for being with us.
Thank you, Twee.
And now for more analysis of how the GOP's healthcare proposal would affect California, I'm joined by KQED health editor Carrie Feibel, and also Hoover Institution research fellow Lanhee Chen, who has also worked on the presidential campaigns of Mitt Romney and Marco Rubio. Welcome to you both.
Thank you.
So Lanhee, you just heard what State Insurance Commissioner Dave Jones had to say about the House GOP healthcare bill. Your thoughts?
I think it's unfortunate fear-mongering at this point, frankly, because what we have so far is the introduction of a bill that I think will change substantially as this goes through the process and as Republicans try to garner support even amongst their own ranks. I think what you're going to see is you're going to see changes. For example, one of the issues he brings up is the tax credit. And I would agree, by the way, I think the tax credit as currently structured is not going to provide enough support to low-income Americans. And so they're going to have to make some changes there. But to automatically turn this into a political discussion, calling it Trump care, basically fear-mongering, I think is fundamentally inappropriate and puts us on an incorrect path in terms of trying to find agreement and consensus on an important issue.
Is it fear-mongering, Carrie?
Well, I mean, the numbers are what the numbers are. This replaces the subsidies under the Affordable Care Act with lower subsidies overall. It will depend on individual Californians how they'll be affected. But if you take a 60-year-old in Santa Cruz, currently under the Affordable Care Act, if that person makes $40,000 a year under the Affordable Care Act, they'll get more than $12,000 of assistance to purchase health insurance. But under this Republican plan, only $4,000. So, there are winners and losers. In Southern California, healthcare costs less than in the northern part of the state. If you had a 27-year-old in LA, theoretically, she also makes $40,000, but she gets nothing under the Affordable Care Act because she's younger, healthier, pays less in premiums. But under this, she would get $2,000 to go out and purchase healthcare. So there are winners and losers, but right now, these are the amounts that are being offered.
And also, Commissioner Jones pointed to an irony here, right, in that in many of the rural counties where there was stronger support than for President Trump than in other more urban counties, those are the counties that are likely to lose the most because they have higher percentages of people in the Medi-Cal program and higher percentages of people in the health exchange.
Right, and I mean, if you just take one of the districts, Kevin McCarthy's district around Bakersfield, those are some of the counties in California with the most people on Medi-Cal. And 81,000 people in his congressional district are getting insurance either through Medi-Cal or other parts of the Affordable Care Act, and that's more than 10% of his constituents. So there's going to be an interesting political tension that will play out in some of those counties while the details of this bill trickle down.
But I think you asked a very interesting question of the commissioner in your interview with him. When you asked him if he'd be willing to raise taxes in order to backfill whatever federal money comes away from this. And really, fundamentally, Medicaid reform to a certain degree is about asking states to make priorities, to figure out what choices they're going to make as they look at overall state spending. And there are a lot of priorities in California that people care about: education, the environment, infrastructure, and health care. But at the end of the day, I think what this reform is also designed to do is to ask states to make those decisions. And yes, some states are going to make the decision, for example, to raise taxes, but that ultimately is a political question. And if the leaders of this state make that decision to keep the same number of people covered, which they could, then that ultimately is a decision that they should be entitled to make. And I think that is what the reform tries to do, is to give states greater flexibility around their Medicaid programs.
But wouldn't some people argue, though, that was essentially what we had before Obamacare? It did not work, and that's why the reform happened.
Well, the challenge is what Obamacare did was to broadly expand Medicaid. If you look at the coverage gains that came from the Affordable Care Act, about 80% of them, according to some estimates, came from the Medicaid expansion. The challenge with Medicaid is, while in California we have a relatively lean system, other states don't have the same lean systems. And in fact, in some states, there can be an argument made that the health outcomes of people on Medicaid aren't any better than the people who are uninsured. So in fact, there is a lot of controversy about whether Medicaid is the right way to cover people or not.
But Medicaid is not just healthcare for low-income people. It is coverage for people with disabilities. It's long-term care that's not offered under under Medicare. So you have people in nursing homes who are being cared for through Medicaid. So you know, it's a broader safety net than a lot of people realize. And this Republican plan would also radically restructure that traditional type of Medi-Cal and Medicaid. So that could threaten, you know, funding for people, and the state will have to make very difficult choices on whether to cut some services.
So let's talk some more about the safety net,
Sure.
which you just brought up. Will there be an impact on ERs and safety net clinics if you have greater numbers of people who are uninsured?
Definitely. I mean, we will see what we saw before the Affordable Care Act: more people turning to emergency rooms, more people going to government-funded clinics, and even jails will be stepping into the breach when you don't have people getting mental health care. Some of them end up in jails, and that's where they get some of the care they need. I mean, I was a healthcare reporter in Houston, Texas, and by default, the county jail there was the largest mental hospital in the state because a quarter of the inmates were on some sort of psychiatric medication. So, you know, that's the type of thing we can see. The cost of having the uninsured rate in California go up gets pushed down onto the local taxpayers. So those costs don't go away, they just get spread differently.
I think there are a couple elements here, though. First of all, what the Republican proposal does is to restore a decent amount of what was known as disproportionate share hospital funding, which essentially helps safety net hospitals compensate for the fact that they treat many uninsured. Now, it's not going to completely fill the void, but certainly that will help. The second issue is that actually under Obamacare, you still had over 20 million people who were uninsured, even in full implementation of the law. So the notion that somehow Obamacare was a full insurance or insurance for everyone law is simply incorrect. The last point to bear in mind is this. I do think it's the case that we're going to be left in a situation where many Americans are going to be looking for coverage unless they look at the current structure of the bill and change it. And I do think this is an iterative process. I keep returning to that point because it's crucially important. And at the end of that process, I do think they're going to come out with something better than they have now.
Well, let me ask you about that, about the process, right? Let's take a step back and look back. You were an advisor on Mitt Romney's presidential campaign in 2006 when Romney was governor of Massachusetts. That state enacted health care reform. Many people referred to it as Romneycare. Yeah. Now, a lot of Romneycare looks awfully similar to Obamacare. Are there elements of Obamacare that you think Republicans should keep?
Well, you know, under the current reconciliation bill they're considering, what they have made the decision to do for a variety of reasons, some of which are structural, some of which are procedural, is to keep in place, for example, the requirement that insurers write policy, something known as guaranteed issue. They've also fundamentally kept in place this sort of modified community rating structure. I think that there might be a reason to do some of that and to keep some of that in place. Protections that are very popular, for example, like allowing people who are under 26 to remain on their parents' plans. I think that also is something that they've decided to keep. So I think there are elements they've decided to keep in place, but ultimately it's very difficult to pick and choose at the end of the day. And I think Republicans are going to have to realize that as they move forward here.
Okay, and we know that the Congressional Budget Office is looking at this, and they may have their own report out as early as Monday. But I want to thank you both for being here. Lanhee Chen with the Hoover Institution, and also our own KQED health editor, Carrie Feibel.
Thank you.
This week, Wikileaks released thousands of documents describing the methods the CIA uses to hack into smartphones and internet-connected devices. The CIA would not confirm the authenticity of the documents, but issued a statement saying the agency does not conduct domestic surveillance activities. Yesterday, founder Julian Assange said Wikileaks would work with tech companies like Apple and Google to help them fix vulnerabilities in their products. This latest document dumped by the controversial organization raises alarm about the scope of cyber espionage and just how vulnerable ordinary citizens are to surveillance and hacking. I'm joined now by Cindy Cohn, the executive director of the Electronic Frontier Foundation. Cindy, thanks for being here.
Thank you.
So Julian Assange now saying he'll make those tools, reveal that code to tech companies. Are there risks for the companies, though, if they accept this? It's illegally obtained classified information.
Well, technically maybe, but I still think it's a good thing, and I think that we should be outraged if the government was going to go after these companies. I mean, remember, after all, these are companies who are trying to make their technologies safer, and this information is what they need in order to make their technologies safer. The fact that it got classified is because the government realized that there were vulnerabilities in these technologies and decided not to tell them. So that's not what the classified information rules are meant to do, and it would be a really big misuse of them if they did.
Does this release, though, make us more vulnerable as a nation?
Well, it makes the CIA's job harder, so to that extent, yes. But remember what these are. These are vulnerabilities in our technologies. So while it might make the CIA's offensive capabilities hurt a little bit, it's going to make us all a lot safer because these vulnerabilities are going to be patched. So as a defensive matter, making our technologies safer is better for us. I think of this like a house. You know, if the cops walk by and they see that your front door lock is broken, they should tell you, so you should fix it. They shouldn't just make a note of it and then not tell you because later, you know, they might need to get in because you're a criminal. Stripped of the digital trappings, that's kind of what the CIA did here. And then they lost control of that information, so now bad guys have it. So I think the right thing to do is for the CIA to adjust course and start working with the tech companies to plug these holes and to make us more secure.
Given, though, this era that we have now of cyber warfare, couldn't a case be made for the government to be able to have secret hacking tools that stay secret so that they can track adversaries abroad, keep the nation safe?
Sure, I think there's a room for that, but I think that what needs to happen is that this needs to be brought into a process where the offensive benefits like that are weighed against the defensive benefits to the rest of us of having more secure devices. So there may be a place for some of these exploits to be held by the government, but I think that should be very small because I think the most important thing for the government to do is to be on our side to make sure that our tools are safe. We're talking about TVs in people's homes, we're talking about baby monitors, we're talking about phones, computers, things that have our most precious information on it. This isn't some small side effect of the CIA's activities. This is about our basic security, not just from the CIA, but from cyber criminals and other hostile actors.
And all those devices that you just mentioned, the baby monitors, the TVs, for example, it all falls into what people often describe as the Internet of Things. What other new devices are you seeing out there coming onto the marketplace in households with built-in sensors, and how good is the security on them?
Well, sadly, in the Internet of Things, we're finding that the security is not good. In fact, it's at most an afterthought. And we're seeing increasing numbers of things that are connected to the internet. We're seeing refrigerators, we're seeing TVs. Recently, I saw some shoes that were connected to the internet. So all sorts of things.
How do the shoes work?
Well, they're connected to maps,
I
so
see.
that instead of looking at your phone, your shoes are going to tell you where you need to go. But they're connected to the internet. Anything that's connected to the internet needs to have serious security in it. And we're not seeing that in the Internet of Things. I'm hopeful that releases like this could help spur that because consumers need to start asking the right questions.
And what else can consumers do to keep their information safe?
Well, most importantly, consumers should make sure they take the security updates. If you get an update from some software that you're using that says there's a security update, absolutely take it. Security is a cat and mouse game where the bad guys are always finding ways in and the good guys are always trying to make things more secure and plug the holes. So for all the rest of us, we need to make sure that we keep our software as up to date as possible. That's the best protection that we can have. And then secondarily, we need to start demanding security as a priority in the things that we buy.
And are Silicon Valley tech companies doing enough in that realm?
Well, some are, and some are making some good strides. Others, like the Internet of Things companies, sadly sometimes aren't. We know the good news is that the secure applications like Signal and WhatsApp that people have been relying on to do political organizing and other sensitive things, they appear to be pretty secure. The CIA couldn't break them. The phones, however, and the operating systems that rest on this, I think of this as like the foundation of the house versus the house. The security apps like Signal, they've turned out to be pretty secure. The foundations that they rest on in our phones and on our computers, there's still work to be done there. Tech companies are starting to step up. I'd like to see them do more. And I'd like to see other companies like the Internet of Things companies really take some big steps.
Overall, though, this latest Wikileaks release, and Julian Assange said more is coming, what will be the overall impact on Silicon Valley companies? Well,
I hope it'll make Silicon Valley companies both continue their efforts and step up their efforts to make more secure tools. I also hope that they will work with us to try to get the CIA and the government in general to stand more on the side of making us all safe rather than making sure that they can get into every device that we have. Offense matters, defense matters more for all the rest of us. These are our tools, they're in our homes, and they need to be made secure. That should be the priority.
Cindy Cohn with the Electronic Frontier Foundation, thank you.
Thank you.
Whether it's a used couch or room for rent, Craigslist was one of the first internet marketplaces. Founder Craig Newmark is a computer programmer turned philanthropist, and he's now focusing on journalism. Last week, his foundation gave $1 million to support the investigative work of ProPublica. He's also given money to the Poynter Institute and PolitiFact, as well as KQED, for election coverage last fall. I spoke with Craig Newmark earlier about protecting trustworthy journalism. First of all, what are you hoping to accomplish by donating to nonprofit journalism organizations?
I'm a news consumer, and I want news I can trust. I've looked at the business a bit, and it occurs to me the best way to help get there is by supporting the nonprofits which are pushing the whole industry towards getting a lot more serious about ethics and getting a lot more serious about protecting reporters against harassment and trolling.
And lawsuits.
And lawsuits.
And what inspired this? Have you been thinking about it for a long time, or the presidential election is what made you really motivated to do this?
I've been actively involved in some of these trustworthy journalism efforts for 5-7 years. What inspired me was high school history. Mr. Shulsky helped us understand the role of a press in a democracy. The way I put it now is that a trustworthy press is the immune system of democracy.
Well, how do you define trustworthy in today's polarized environment?
Basically, if a news organization has a code of ethics, if they have a diversity policy where they listen to everyone, and if they have a process for accountability and corrections, I'm willing to do the honor system thing and start by assuming that they're going to be trustworthy.
We've seen a decline in trust in the media over a series of decades. And as a result, people are questioning who gets to define who's credible and who's not. Who gets to define what's news and what's not?
You really don't want to have someone on TV who's not going to be honest with you. The problem is that even if you point out that something's a lie, that what listeners will hear will be the lie. And if you hear the lie again over and over again, it starts to feel like truth. What's happening now is that Poynter Institute has created the International Fact-Checking Network. That includes PolitiFact, Snopes, and others. The deal is that they have great track records, and they make everything they do transparent, so you can check for yourself if the fact checker is being honest.
So in this environment, what is the best way to do trustworthy journalism? The fact checking you just mentioned, what else would you like to see done?
One thing that you avoid doing is repeating lies no matter who makes them. And then the other thing is just to return to traditional journalistic values where people would actually do the research, they would get multiple sources, they would check the facts, and if something does go wrong, because sometimes, people have lapses, then you fix it.
You have said that the tech companies could present better options for news consumers, right? Maybe Google has some kind of system where it allows you to only see news from trustworthy sources. How difficult is it to cut down on fake news in this environment now where we have news from so many sources. Gone are the Woodward and Bernstein days where it's, one guy in a trench coat, your main source. Now your source is everywhere. It could be a hacker in Romania.
So when you're looking at the results of a news aggregator, let's say Google or even Facebook, Apple, Twitter are news aggregators of sorts. What I'd like to do is to check a box which says, only show me an article from a trustworthy source. And when they're building the page of results for you, they can exclude those stories which are from not trustworthy places.
You were once in the media, you were called the exploder of journalism because your site Craigslist helped to contribute to the decline of newspapers by taking away their classified ads revenue. Some people find it ironic that you are now emerging as someone who's carrying the banner for good journalism.
Well, I have to question your premise because I've now spent time talking to people who really know the business, like Ken Doctor, like Tom Bechtel, Kelly McBride, and others at Pointer. And they point out to me that there's no evidence that Craigslist had much of an effect, that it seems more strongly correlated with the rise of Facebook, with the rise of Google. It also correlates to Wall Street and investors taking over newspapers and asking for greater profit margins.
Do you think that tech leaders have a special obligation to help clean up the fake news problem, since much of it is disseminated through the technology they helped create?
I won't make the judgment about other people and their companies. All I really know for sure is that I feel like I should do something, so I'm doing something.
Where do you see journalism 5 years from now? Where would you like it to be 5 years from now?
I would like to see a relatively small set of news organizations covering global issues, covering national issues and local issues. I am hoping that the survivors who are making lots of money are ones with high ethical standards.
Well, thank you for spending the time with us. We appreciate having you here. Craig Newmark.
My pleasure.
And that does it for us. For more of our news coverage, go to kqed.org/newsroom. I'm Thuy Vu. Thanks for watching.